And we're back now with Sunday House Call. You get acid reflux? A lot of people do. And heartburn, you know how that feels? Well, sometimes those terms are both used interchangeably, but they are actually two different conditions. Dr. Siegel, a lot of people suffer from this.
First of all, let's talk about what heartburn is. That's a pain that you're getting that sounds like it's your heart. Well, you know what? If you're getting it, I want to make sure it's not your heart. So don't just say you have it. See your doctor if you're getting burning in your chest, even if it's not radiating to your arm, even if you're not short of breath, get checked. Heartburn can be a manifestation of acid reflux, where the sphincter that connects the esophagus and the stomach is loose, and acid comes up. If it's more than twice a week, we call it GERD, gastroesophageal reflux disease. And then I start saying, lose weight, cut down on smoking, get rid of chocolate, cut down on coffee, which we love on the show here, eat less fried food. Fried food is a huge, huge cause of this, fatty food. And then the main, and alcohol. Alcohol and smoking are big ones, and exercise more. Now, if all of that is not working, then you should see your physician, and we may have to try to treat it with medication.
Dr. Siegel, excuse me, you say it happens when the sphincter is loose. Can you operate to tighten it?
You can. You can operate to tighten it. There's limited procedures that you can do through scopes now that work, but that's not a first resort.
Sure.
That's a last resort. Lifestyle is the first resort. You simply lose weight, it's going to improve.
So how do you know which one you have?
Well, it's not so much important what you really have. The fact is that if you have reflux, right, so short term, once in a while, you may have a bad food or a big steak, and you may have reflux, no big deal. Nobody cares, nobody treats it. But if it becomes a chronic disease, if you're having it twice a week, then you have a real GERD and an issue. Now, why does this happen? Anything that would increase the pressure in the stomach, or anything that will loosen up that sphincter, then you're going to have acid going up. So something called hiatal hernia. You may have a hernia of your stomach that pushes the acid up. If you have chocolate, that's going to relax it. If you're pregnant and that pregnancy is pushing against the stomach, obesity. When you have alcohol or smoking, you're opening up the sphincter and it goes up. So what's the big deal? If you have reflux, you can cause scarring and bleeding of the esophageal area, those cells, something called Barrett's esophagus that prones you to have cancer. And a lot of times, if the reflux goes all the way up to your mouth, you're going to have bad breath, you're going to have tooth decay. We're seeing the dentists can detect this.
Great point.
And also dry cough. If you have dry cough, it's not always asthma, it's not always allergy. It's basically going after your vocal cord. So that's why it's important to treat this.
So how do you treat it in
Yeah, like you got a lot of over-the-counter medications.
I talked about I forgot one treatment. Yeah. You know how last week I talked about aspirin being a cheap treatment? I have an even cheaper treatment for this.
Don't take aspirin.
Water. Drink water. If you drink a lot of water, don't take aspirin. That aspirin can actually bring this on.
Make it worse.
The aspirin can make this worse. Coffee can make it worse. Alcohol, smoking really makes this worse. But if you drink a lot of water and you elevate the head of the bed at night before you go to sleep, those are key tips.
Don't eat late. Elevate your head. And what about
and don't self-medicate, by the way, Eric. You were about to get to this point.
I was talking about Prilosec next.
Don't take it yourself. Talk to your doctor about whether you need that. Because once you're on it, it's hard to get off it.
Usually fatty food and big amount of food late at night and lying flat is another major risk factor. So make sure you don't do that. And I think there's a lot of antacids that you can take over the counter if it's early on.
Right.
But you don't want to share these medications from your neighbors and grab those because they all have side effects. Okay. And you only want to be on those medications for short period, not prolonged period.
Talk to your doctor. Good advice.
Very good.